Hi.
Hello, everybody. My name is Ken Abrams. At Deloitte, I serve as the firm's Chief Medical Officer.
Good afternoon, everybody, and thanks for taking the time to spend with us again today. I get the privilege of hosting today's discussion, where we'll talk a little bit about virtual health and specifically focus on some of the concepts around the ability to deliver hospital-level care at home. I am a physician. I'm an anesthesia critical care doc by training, and then I joined Deloitte 9 years ago now. I'm Deloitte's Chief Medical Officer for the U.S., and have the privilege of working with a group of about 65 physicians, clinicians, and scientists in the firm as we serve clients in lots of different ways across life science and healthcare. Unity, I'm kind of curious, right, with your portfolio and as you're looking at startups, how much of this is focused on, creating these kind of devices and platforms and technologies?
A lot of these technologies have been around for years. There's been billions of dollars, close to $60 billion invested in the past 10 years in digital health technologies and innovation. And what we hadn't seen is much adoption of these technologies, both on the patient side as well as the systems or providers themselves. And what has really changed overnight is a forced kind of behavior change or adoption across the board. So these tools around diagnostics, around testing, around telehealth, are now seeing an overnight sort of transformation in terms of the use. Health systems, hospitals, clinics, they're very rapidly trying, if they didn't have virtual care solutions put in place, they're putting these systems in place now.
So I think the structure of the doctor-patient thing is going to change. A way to check in and gently remind you that you are due for something, need something, should take something. I think that's going to be part of this systemic change as well as telehealth.
The technology is actually relatively inexpensive. When you think about where all the other costs are. So when you get these things actually used at scale by all the physicians, by all the patients, I think there's potential to drive the costs down for the health systems, for the payers, and for the patients.
Apps are starting to get certified by the FDA for mental health, for ADD, for diabetes, so that your doctor could prescribe an app as easily as an aspirin.
So I think there's going to be a big advancement in the long run where we're going to see significant reductions in the overall costs through the adoption of these technologies and capabilities. And I think one area, it's a good segue, right? So one area is that we're starting to see emergence is around this concept of hospital level care at home. And I don't know if you guys have heard much about that or not, but that might be a really good place to transition this conversation to, because it has the ability to actually dramatically reduce the cost of care.
I've been following a lot of stories of people who have had surgery and they were able to go home the next day because a team came in and set up everything that they needed to convalesce and recuperate in the comfort of their own home, but be monitored remotely by systems that are in place that have helped just tenfold down the road. I haven't heard any horror stories about things like this, even from my cousin who had a baby 3 days ago via C-section and was sent home 1 day later with everything in place at home. And she's been able to recuperate at home. It's been a great outcome for her baby, for her husband.
The aging, the elderly community who it's very expensive to go to the hospital. It's very disorienting. It's isolating. But to be able to age in place, and you're seeing things like fall detection systems. So if you don't take the fall in the first place, you can avoid the hospital visit. You're seeing, diabetes in particular, with medicine reminder, with digital pill boxes, with nutrition that comes and Skypes in or Zooms in and tries to help your eating. All of these things will cut the enormous burden off of repeat hospital visits in the populations that most likely to have them, I think.
We are seeing the ability to actually deliver that kind of care today at home. So whether it's the post-operative recovery, right, from your joint replacement, your cesarean delivery, or somebody who's got pneumonia or cellulitis or vasculitis, right, bring them into the home, set them up with a digital toolkit, right, that's necessary to continue the monitoring, pulse oximeter, blood pressure, spirometry, whatever's going to be needed based on their underlying conditions as well as the acute condition, right? And instead of admitting them to the brick and mortar of the hospital that we know, admit them to their home, right? Enroll them in their program, connect them with the devices to a command center, kind of like we've got running now, right? Where I can see those vital signs that come in, the results of their blood glucose as they're checking it, right? And all of those components. If we're talking about the elderly, how many elderly get disoriented when they get admitted to the hospital? Elena, you probably see it all the time.
That is the number one thing. They're delirious, haven't drunk, then you get tested for UTI and then all this other stuff, and then they're admitted. I agree with everything that's been said. We really try and keep people at home as much as possible, and that's one of the challenges we have, is building up that community support, so they don't even have to go to the hospital.
I do want to thank everybody for participating today. This has been a really engaging and stimulating conversation. I have learned a ton from all of you, so thank you for sharing your thoughts and participating. We really do appreciate it.
Thank you, everyone.
Thank you, everybody. Have a wonderful week.
Stay well, everybody.
Stay well.
Thanks so much for moderating. Take care.